Morning.
Hey, how you doing? Good, thanks. Good days and bad days. Brendan's been doing a lot of work with her. He drives her grocery store, get her hair done. She called him the other day and said, the car needs to be washed. And so he never says no, so I think she calls him.
You almost got me. I was jumping up. I'm like, what? Who's coming in? I know, man. Yes, sir.
Folks, thanks for waiting. I apologize, I'm a couple minutes late. I was just telling Jimmy that anyone that has children that plays hockey, it's a very, very long season.
Expensive too.
And I got one more practice on Friday.
Reminder that the Bruins face-off is at 7 o'clock.
That's right, and the Bruins are on tonight, so we're gonna try to keep this moving smoothly. So how we don't cause any problems
I
tonight,
won't cause
please.
any problems, I promise.
Okay, so it's about 6:35. We're gonna call this public safety meeting tonight on. We have one of these. Thank you.
First, I make a motion to approve the previous minutes.
Second?
All in favor? Aye. Sure. Yep. Quickly, today is March 23rd. It's 6:35. To my immediate right is Counselor at Large Jimmy Leahy, Counselor at Large Howie Graney, and Counselor at Large Mike Sullivan. Myself, Dan Bresnan.
That's your left, Danny.
I'm still cold from the ice. The first order is an order filed by Todd McGee. Take a motion to take off the table.
Second.
All in favor? Aye. Order that the Public Safety Committee invite in both the Chief of Police, Fire Chief, and representative from Holyoke Medical Center to discuss the new ambulance service within the city. So please, Chief, there's, or Manny, yeah, thank you.
We have Carl Cameron from Holyoke Medical Center. We also have the
Sure, great, invite everybody up, yep, yep. Feel free, sure, yeah, of course. If you guys have something to say, I mean, we're all family here, so it's very loose. All you gotta do is hit the button in front of you that ignites the microphone. Right, is that the right word?
You guys all
close
like?
enough.
Push that button in front of you.
Little green button, should be a green.
Just says push, don't pull, it says push. Should be good to go.
How if you have a heart attack, this is the place to have it right now.
Just make sure it's not you that gives me mouth to mouth, that's all. Jeez. I know that you still don't do that, do you, resuscitation?
Is there a go-to person on this? I mean, like a main person, just so we don't have to.
Counselor, Chief Khan oversees the
Okay.
service in general. Carl is the hospital, and here for
I'm just gonna go through the names. So Carl Cameron, right?
Yeah.
Okay.
Michael Waronka
I'm
from
just gonna,
Action Ambulance.
just gonna put a W. Is that all right? Is that what it
W,
starts
yeah.
off with?
No problem.
All right. Frank, how are you?
What is that?
And-
Oh, explain your name. I thought it was an acronym.
No, and now you are with. Forgive me.
Action Ambulance.
Action. Okay. I know you, Commissioner, of course. Commissioner, of course. I'm gonna have to assume you two guys are basically the bus drivers. Okay. Or in that you don't have the fancy suit and tie, so you guys are not.
He's the CEO.
You're the CEO.
I am the CEO. I own the company.
Okay. Wow. Yes. You know sometimes you wear ties and suits when you own companies, right?
It depends on the situation. If I have to be in the field, I'll be in the field.
Not these guys, but these guys.
And of course, Linda Vacon has joined us from Ward 5. Thank you, Councilor Vacon. All right, so the gist of this order is, gentlemen, we had received from our law department a copy of the new contract, and I can speak for Tom McGee, who did reach out to me and said he couldn't make the meeting. You know, AMR was here for a long time. We have no animosity towards or love towards either company. So we're just trying to get an idea of, you know, the services that are different, who was involved with the contract negotiations, is there any different negotiation from the previous contract than there is with this contract? Now, again, we have yet to see a copy of the previous contract, which is not an issue for your folks. So we're just trying to get an idea of, you know, where you're stationed, how things are going, how long the contract has been in effect, and anyone at any time can speak to any of these points. So if somebody just wants to maybe start us off at how this all came about, Chief, please.
Yes, I'll start. Thank you. As you know, we looked at changing our ambulance provider, so we put together a committee, myself, the police chief, Rory Casey, Lori Belanger from purchasing, and Paul Payer from city solicitor's office. We put it out to bid. We had 4 people apply for it, and we narrowed it down to 3 providers. That would be Alert, AMR, and Action. We interviewed all 3 companies. We told them what we were looking for, and ultimately we came up and we picked Action Ambulance for the service. If we can get a background on AMR, they did a great job here in the city. Their contract, I'm surprised you didn't receive that. Some of the things in their contract were not suitable for what we needed to do in the city. One of them was they would keep 2 ambulances in the cities at all time, comma, if available. Well, that's not going to work. We're the city of Holyoke, we deserve better than that. So one of the things we want to do with this contract was ensure we had a specified number of ambulances in the city. So now Action Ambulance has 3 ambulances, 24/7, no questions asked, in the city. 1 is a BLS, which is basic life support, and 2 are ALS, which is advanced life support. Those 3 ambulances are at fire stations currently.
Chief, what stations are they at?
At Station 3, which is 1579 Northampton Street, Station 5, which is 33 Whiting Farms Road, and down here at Fire Headquarters, which is 600 High Street.
Gotcha.
So the reason we do that is the same reason we provide fire protection for the city. When you have specified locations where they can respond from, you're going to increase your response times, or I should say, lower your response times. You'll get there quicker because obviously they're spread out through the city instead of one central location. And I'll let Action talk to where they're at on other locations in the city. So that was one of our main goals, is to make sure we could provide the right EMS service for the city, and Action stepped up, took the ball, and we're going through, as we go along, we're learning a few things, but I'm very happy with the service at this point going into this contract. And as you can see, this contract has quite a few pages. The original one, AMR, was maybe 3-4 pages, not much substance to it. And when I talk about a contractor agreement, this is for the 911 services for the city only. This is our side of it. This is a 3-way collaboration between Action, the city of Holyoke, and the Holyoke Medical Center, which they can speak to as we go forward. I guess that's probably about it in a nutshell, gentlemen.
I'm just gonna, let me just get a couple questions, and I apologize if my head's down. Unfortunately, I have to take notes as well as kind of run the meeting, but, just to be, do you have basic life, advanced life? It does not, I mean, it kind of makes sense, but maybe for the public or for folks that might not, could you just touch upon the difference between basic life and again, indicate there's 1 basic life, 2 advanced, or vice versa?
BLS is, you have 2 EMTs on an ambulance, and a ALS is a paramedic and a basic EMT on an ambulance. They're all transporting ambulances, which means they can pick up a patient and roll out to take them to the hospital.
And how many, so of the 3 ambulances, how many are basic life and how many are advanced?
1 BLS, 2 ALS.
Gotcha.
Can you also just describe, if, just jumping in, between an EMT and a paramedic?
I should probably let them do it, but I can tell you, as an EMT, basic EMT is just the lowest level of EMT, emergency medical technician, and a paramedic is much more advanced, with much more training.
Yeah, happily, I'll jump in. On the paramedic level, paramedics are allowed to do sophisticated EKG interpretation, carry a host of medications to speed someone's heart up, slow it down, resuscitate people that are unconscious, start intravenous lines, put advanced airways in from a breathing perspective as well. So they're able to kind of bring a large portion of the emergency room right to the patient's side.
And they're actually on the bus? In the case of, so we have two ambulances that actually have paramedics on board?
That's correct. And then we have additional trucks, and we have another 24/7 paramedic unit that's based out of South Street as well. That augments the system too, and is also committed to service the hospital as well.
So it's basically, having a paramedic is almost like having like a mini emergency room on the ambulance?
Correct.
Okay. Counselor Graney?
Just quickly, I certainly know firsthand how critical this service is. Having the EMTs and I believe it was AMR at the time in the Holyoke Fire Department pulled me out of the dirt a year ago in August when I went into cardiac arrest, and they brought me back. I spent 48 hours or close to 3 days unconscious in the hospital, rest a whole bit. So, you know, I appreciate what you guys do. I appreciate the Holyoke Fire Department because I'm living, breathing proof that this type of service really works for the citizens of Holyoke. Just briefly, what's your response time once you get the 911 call?
So we met, was it about March 15th to review the February data, Chief? And we're about that time, maybe a little bit before then. So our statistical data just for the month of February alone, and remember that it was a 28-day month, the system did about 950 responses. Of that 950 in 1 month, and it's a 28-day month too. So so it's running about 29 transports per day in the system. With that being said, about 805 are resulting in a transport for the system. I don't have the numbers with me offhand, but the average response time was running about, I want to say it was almost just under 5 minutes for the entire system. So I do want to point out there was one major change in the system design that we implemented in conjunction with the fire department, in that we have created a system where the fire department now is in control of the ambulances as well. So the fire department is dispatching those units to drive response times down. So call notifications are happening quicker to these calls, and because the trucks are in the neighborhoods themselves, the overall response time in the system is down as well too. So I think that everybody was surprised with the amount of volume because we did not have good data coming into the system. But now we have really good data, and we have routine meetings to look at potential outliers. We've even got a GPS system that the fire alarm operators are able to see the locations of the trucks and track those trucks to be able to guide them potentially into calls and to see where the covering trucks and the backup trucks are as well. And the administration staff at the fire department has logins to that system, and we've also provided login information for the police department dispatches to be able to see where those trucks are at all times as well.
And where is Action based out of?
So our corporate offices are in Wilmington,
Okay.
Massachusetts, but we have operations, obviously in this area. We've been operating in Pittsfield since 2011 as well, so we kind of have a statewide presence with our operation.
Councilor Leahy?
Yes. First of all, I echo what Councilor Graney had said.
His wife doesn't though, but the rest of us do.
Ouch. Okay, just a couple of questions. One is, I have, how do you triage, or how do you choose where somebody's going to go, either Holyoke Medical or Bay State?
So it depends on a number of factors. Our preference is to be able to keep trucks in town and to move patients into the medical center. However, there are certain calls in the system, essentially some patients that have special types of heart attacks, and also some patients that are acute trauma patients need to go into a higher care setting area like a trauma center. So depending upon patient condition at the time of the assessment being done by the providers will determine the destination of the patient in the end.
How long does it take to get to Bay State from here?
So,
Original location in the city of Holyoke?
Oh.
14 minutes?
yeah, it's not, yeah.
That's not bad. My second question is, how much is this costing this? I like all the numbers. The numbers are right. How much exactly does this cost the city, and how much does this cost Holyoke Medical? Do we have a partnership with them?
So in terms of the cost to the city and to the medical center, it's a $0 cost. So we're covering the cost of the deployment of our systems, our staff, the IT infrastructure. The issue with us in the medical center is one that's going to be more interwoven over time because we are going to work on a partnership with the medical center to help alleviate emergency room overcrowding on the hospital side of things. And the hospital has a fantastic community outreach program that they've been able to identify high users of the EMS system. And we're going to start working and setting up protocols to work with them collaboratively to be able to work on reaching out to those community members that are high system utilizers to try to keep them out of the emergency room long term, and to be able to do more of a community paramedicine outreach program to those people within the community. So it's really something very unique, something very different that really is not being done at this level of collaboration anyway that we've been able to identify at this point in time.
So basically, the city is just on the hook for providing a location, a fire station for you? So the city pays nothing else?
That is correct.
So So the majority of the money you guys make is from reimbursements, right? So it's either if I have commercial healthcare, he has Medicare Part D, so that's where you guys get paid, right?
Yeah, there's going to be potentially two components here. One of them, we're a fee-for-service model within the current healthcare system. As healthcare continues to evolve and there becomes an at-risk population, that some of the health insurers might be responsible for all of the needs of that population, then that might change some of the reimbursement models, which they probably will in the end. And we're currently working at a legislative level to provide some additional grant funding to support HMC in this new endeavor that we're working on legislatively to get them additional funding to do more outreach into the community by putting potentially case managers, social workers, and mental health workers into the field aligned with our staff.
You're doing like, you're going to do a full circle. You're going to really take care on all sides. So if I'm Medicare, and if I have a heart attack, and if I'm commercial, and if I have a heart attack, how much would I be paying out of pocket?
It all depends on, it's such a complicated equation depending upon deductibles, depending upon where you are in your plan. It's very difficult to tell what the actual true out-of-pocket cost to an individual is because of the layering of Romney Care, then Obamacare, the connector programs, all of those. It's a very difficult and complicated equation to come out and say the cost is going to be A, B, C, or D based upon the level of service provided.
So has the Affordable Care Act that you just mentioned, has that been a good thing for the healthcare profession, or is it not so good?
I think the jury's out on some of that. I think that what's happened is more people are aligned with the Medicaid programs or type of program.
Managed Medicaid.
Managed Medicaid, which has been a negative effect.
Right.
On healthcare as a whole,
Right.
as well as our organization. The question is where the future of that is going to go. And there are a lot of unknowns right now.
Well, thank you for your answers. Chief, this is my last question for now. When you first became chief, we had conversations about having our own ambulance service. How come we're not there yet?
This is no cost to the city to provide EMS service.
Right, so we would have $1 million cost, upfront cost.
You would have to hire more personnel to run an EMS system.
All right, makes sense. All right, thank you.
Yeah, just quickly, on the contract piece, how long is the contract for?
I think it's a 3-year with 2 1-year
The
renewals.
1 year, we can re-up it?
Correct.
And who decides that 1 year re-up? Is it the committee, the law department, or is it the mayor's office?
We'll sit down, review all the information, make sure they're on track where we want them to be, and then if they are, we'll continue on with the agreement.
So when you say we, I would have, there's.
The committee.
That police, fire, Lori, law department, mayor's assistant, it's a formal committee?
Correct.
Gotcha. Counselor Graney?
If you need, in extreme cases, burn units, something like that, airlift capabilities, how quickly can you put that into operation to get somebody, say, to Worcester or Boston or something like that?
Yeah, so the flight services throughout New England is a coordinated system. So all of the flight services share their resources. So all it is us to place a phone call to one of those services, and then they will honor that request to be able to move people either from the scene or from a hospital to move them off to a specialty burn center. So that coordination is done through a central coordination center. I believe it's at Boston Med Flight, which is in Bedford. And then they work on dispatching those helicopters New England-wide. So you just don't know what's going on New England-wide about what resources. So it's just a question of where those resources will ultimately come from to determine what the plan is to move somebody.
Okay, thank you.
Counselor Sullivan and Counselor Vacon?
Just briefly, you said how many calls in February? 900?
We had 950 responses on that 28-day month.
Do you have any idea of those 950 responses? How many were drug overdoses, opioid related?
So in our meeting with our partners at the table, including the police, fire department, law department, and the mayor's office, it was our first meeting to look at the data, and I think that everybody was kind of overwhelmed with the volume of data that needed to be digested. And what we had asked the group is, what additional data do you want to see? What do you want us to drill down to? And the police department was very upfront with us that they want to see subsets of data relative to overdoses and breaking those overdoses down into narcotic-based overdoses compared to potentially alcohol-related overdoses. So we are setting up our system to be able to parse that data, to be able to share it, because the next thing we can do is we can also take that data and map it and provide mapping data to those agencies to share that data to say that these are the neighborhoods that these types of incidents are occurring by mapping it out. So our system will be able to break down those particular types based upon what different departments want to see for data. And there are a couple other data items that we talked about being able to get a handle on it and refining that data. So we're willing to work with those departments to be able to get the data right, to be able to say, okay, this is where we are. And if we have to pivot, we can pivot that data as well to be able to share it.
But you don't have a number yet, what percentage or anything like that?
No, we can't give you an actual percentage right now because when we were at that point in time, we were missing a number of diagnoses just because of the volume of call volume about doing some data entry into the system. But we can go back and look at February data pretty quickly now and parse that out. And we have another meeting set up mid to late February, and then we'll have April. Then we'll have good data for all of March and February to be able to look at that as a percentage standpoint.
Yeah. Well, what I'm thinking too is a lot of these people might be uninsured. We've got all these homeless people on every corner and stuff like that. How do you get reimbursed on calls like that?
Well, we're in a similar situation as the hospital, where the hospital is challenged with those patients as well. So we won't get reimbursed for those particular patients. Some of them end up being on some type of state assistance, and some of them don't. So as part of the system design, that's factored into that. There's a percentage of those patients that we're never going to get reimbursed for, just like the hospital model is similar as well.
Okay, thank you.
You're welcome.
Counselor Vacon?
Thank you, Mr. Chairman. Thanks for coming down. My question is around the gap between the 950 responses and the 805 transports. So in the case where you get called out and you have to respond, but then the person either doesn't need or declines transport, is that another situation in which you don't have an opportunity to bill, or do the people that called you get billed privately if they don't actually accept a transport?
Yeah, the only time that we're permitted to bill is if, in fact, a transport occurs or some level of treatment. And some insurances will allow us to bill for if we were, for example, to wake up a diabetic, and then leave them at the scene if medical control allows us to do that. But that's a very rare occurrence. So typically those are non-billable events.
So that's a pretty high proportion of what you're doing.
It is. When we look at a system, we usually figure about only 75% of the total responses result in a transport. So we're at a higher number in the city than the traditional systems out there.
Okay, I thought it looked pretty high.
Yeah.
Thank you.
I got a couple questions. Just follow-ups on, and please, anyone that knows the answer, it's not directed at anyone, and this is, but what's about the average cost of a transport?
So the average cost is difficult to determine because of the amount of resources in the city. This is a labor-intensive system, so we need to look at some data ultimately we can get that number back to you at some point in time.
I'm not holding anybody to anything. I'm just saying ballpark. Is it a $300 ride? Is it a $1,000 ride? I mean, just an average.
Oh, you mean the average charge?
Yeah, right.
It really comes down to the insurance type, because a emergent patient on Medicaid will get reimbursed probably about $210. On the commercial side, it could be higher. It could be at $1,500, $1,800. It all depends. Medicare only runs about $350 in that area. And typically in a system like this, 60%, if not 65% of the volume is Medicare, Medicaid based in this type of market.
And is there any, to Councilor Sullivan's point, if you pick up someone that doesn't have a health insurance, a homeless person, or whatever the case may be. I mean, can you guys go to Mass Health and be compensated through Mass Health?
No, one thing that we're not allowed to do, that the hospital is allowed to do, is to dip into the free care pool, and we're not permitted to reach into that.
I'm assuming there has not been, and I can certainly, Manny can speak to this, but if there was a constituent complaint about service, or if there was an agency complaint about service, whether it was through the chief of the police department, or any agency, how are complaints handled?
So,
And I know that you basically started a month ago, and if you got to come back and call me or whatever, but I'm just trying to get, this is an education process for many of us, because I don't think I've ever spoken to anyone from AMR except the time they came to my house. But besides, so don't take any of these questions the wrong way, but we're just trying to kind of get our arms around this.
no, one thing that I can say is that we have very open channels of communication between us, the fire chief, and the deputy chief staff at the fire department, as well as we have a key person in the police department at the captain level that's communicating with us routinely, as well as the chief himself. So the channels of communication are very open. We're very happy. If we receive complaints about something going on, we actually track it. We follow up on those complaints. We'll go as far as listening to and reviewing audio tape with what's going on, reviewing the run reports. And we actually work with the medical center that has clinical oversight of our staff. And an ER doc there is assigned to oversee the clinical practice of our staff, and reviews our cases and engages our staff from that standpoint, from a clinical standpoint. So it's a very, I'd say, Chief, very organized system of communication, follow-up, follow-through. Sometimes the complaint's a miscommunication issue. That's the majority of the complaints, or a lack of understanding of the protocols that the paramedics and EMTs have to work under, which are governed by the Commonwealth, and then also by the ER docs too. And most people don't understand those protocols, and it's no different that as if you walk into an emergency room, that emergency room will engage in their own protocol for treating you, and sometimes people don't understand why they follow those particular protocols as well.
Can you tell me, if you know, I mean, I'm assuming you know, what is the average cost of an ambulance? If we, let's just say the city of Holyoke wanted to purchase an ambulance, and again, I'm not holding you to it, I'm just looking for a ballpark figure. I'm not, I don't need to, you don't, whether it has an oxygen tank or doesn't have an oxygen, I'm just saying like a ballpark figure. If a city wanted to get into the game of ambulance services, what would an ambulance cost?
So for a box-size ambulance, could start off at $125,000. And it can run up to $350,000 depending upon the size of the truck that you want to buy.
Okay.
The equipment in the truck, if you're at the paramedic level, can run you up to $75,000 to $85,000 per unit as well. The cardiac monitor alone is about $27,000 to $28,000. No. Yeah, so power stretch is another $15,000.
So you could be looking at, $500,000 for a fully operational, again, ballpark.
As a capital outlay.
Right, as a capital outlay, okay. And Chief, you may know this answer, or the commissioners, I mean, so is the city as an entity, is it receiving anything from housing a full-profit ambulance service company in 3 fire stations?
Part of the agreement is we have 90 days to come up with a lease amount, and we're currently working on that amount, and we'll get that enacted within the 3-month period when this starts.
The contract is in effect currently, correct?
Correct.
Okay. So,
Can I comment? I'll comment about the lease.
yeah, please.
So we are governed by federal regulation on this issue, that it has to be done at fair market value, so that it's not considered a kickback or an inducement for Medicare and Medicaid referrals. So we're walking very slowly through this to make sure that us and or the city are not going to be in jeopardy in terms of being viewed as some type of a kickback for paying for lease space in the city. So it's been a very deliberate process, and both agencies are very concerned that we're doing this the right way.
So within 90 days, give or take, there's going to be some sort of lease amendment to the contract that's going to outline any compensation that the city of Holyoke is going to have for maintaining the ambulances in our buildings. Is that
For garaging, correct.
Is that a correct statement? Okay. Is the fire department still responding to these calls that, I mean, you know, we don't have any ambulances, the tactical units are what we have. We're being told that we have 3 ambulances very close to home. So I can imagine that either the tactical units are gonna come offline, we're gonna sell them, or just so we're not dispatching people, you know, firemen, taking the time, the gas, all that to a service call when we have 3 ambulances that are only serving the city of Holyoke.
Short answer, yes, but there's a lot of particulars involved. The TAC vehicles are past their time anyway, so they're going to have to be taken out of service at some point. The goal is to have all the engines and ladder trucks carry EpiPens and any medications that we can as a basic EMT. So we're working on that. As far as responses, this is why the system will work. We have an ambulance in 3 of the stations. So if Med 1, which is down here at Station 1, is out on a medical call, and another medical call comes in a different location, that's when we can dispatch the engine to go down and respond in that location. So we always have somebody responding to something. Some of our protocols will call for difficulty breathing, chest pain. We'll go with an ambulance to that call to help that person in case there's an emergency that we can assist the ambulance with. So there are specified calls that we will go with an ambulance to help them, and then there are other calls where we're going to be in a station waiting for the next medical call or fire.
Because I have to imagine if there's been 900 calls in 28 days, and we'll just make it easy to say 30 days, and there's 3 ambulances, I mean, I would have to imagine that the fire department is still responding to medical emergencies within the city of Holyoke.
We still are a Class 5 ambulance. We're going to continue that trend, but we're there to support and also go out and help the community with medical emergencies.
Right, if engines are responding to people not breathing intact, I'm just thinking, you know, again, just cost effectiveness for an entire engine to show up to, you know, somebody got hurt on a baseball diamond and the ambulance is not here because it's responding to something else.
I would rather have them respond with an engine in case there's a fire or another emergency in that area. They're not going to have to go back to the station, get the engine, and drive back. So it only makes sense to respond in an engine.
Transportation for that patient still would be an issue.
If they have to be transported, well, since we're dispatching from our own dispatch center, they know we're responding. They're sending a medical unit from another location to come down and meet us there as well. So it works.
I'm sorry. I didn't mean
Go
that.
ahead.
One of the things that might be worth mentioning is we have 8, 7, 9 different ambulances in the city at a time now. The 3 dedicated ambulances are just that, dedicated. But we also have 6 or 7 ambulances in the city all the time. That's one of the differences in this contract and your prior provider is we're basing ambulances here in the city. Previously, if the call volume exceeded those 3 ambulances, they called for responses from Chicopee or Springfield. So we have, for example, tomorrow 9 ambulances in the city because Friday has, even in the short amount of time, proven to be a busier day. So on Friday and Saturday night, we have 10 ambulances in the city. So as the chief is saying, that they're also responding to some of these calls when our initial 3 ambulances are in use, but we're also using these other ambulances to supplement that system.
There's no cost.
None.
To the city, so you could have 20 ambulances from your company.
Correct.
Organization here. Practice at all.
No.
Danny, quick.
Council Grady?
Yeah, quickly, just one for Carl. You know, the new Holyoke Medical Center emergency room is going to certainly increase our ability to serve our population. How close are we, Carl?
Well, I expect construction done by the end of May, and then we've got to go through the DPH approval process, which who knows how long that's going to take right now, honestly, because they're short-staffed with early retirements, but I'm hoping by mid-July we're ready to go.
Boy, that'd be wonderful, because it looks like it's really coming along over there, you know, so that's...
Yeah, and we expect volume is going to go up when that opens up with the new emergency room. We've got a dedicated area for behavioral health, so our behavioral health patients will no longer be in the main AD. We can give better care to those patients. As others stated earlier, we've been working very hard on keeping the high utilizer patients out of the emergency room and bringing care out to the community. And one of the things that I'm really excited about in this whole transition is, Mike talked a little bit about it, it's called mobile integrated health, where we start to partner up social workers, mental health workers with EMTs, and we actually do visits out in the community to the homes to keep those patients out of the emergency, keep medical costs down as, healthcare payers transition to what's called accountable care organizations, where they look at the total medical cost of patients versus paying on a per visit cost. So we're really excited about that. The problem is you don't get paid for that right now. So we're working with Action and the legislators to see if we can get some funding for that to prove that that concept will actually work and help drive costs down going forward.
Is there going to be a high trauma center that's in the emergency room too?
No.
Okay.
Carl, so Holyoke Medical Center, have you sat at the table for contract negotiations before?
I have, yes.
Were you notified about the contract negotiations with this one?
We found out after the RFPs went out and they got to the final stages of the three. We were approached at that point about it and asked for, pretty much our input into the process. Now, I got to be honest with you, our goal is to make sure the residents and our patients get the best care because we have medical oversight of, it doesn't matter what ambulance service it is. So we didn't have a preference to AMR or Action. It really the city that drives the E911. I can tell you once Action was selected for E911, we also contracted with Action to do what's called interfacility transfers. So when we have a patient who goes to a nursing home or needs to go to Bay State, Action is our primary service for doing those transfers as well. And when we went through the contract process, we held them to certain protocols and standards that we expect to happen as we move forward. And I think in the collaborative approach, and I think it was much more collaborative than probably it was earlier on with AMR 10 years ago. The chief has been very open with us. Action's been very open to us. And honestly, I've said to them that we're going to hold them to a high standard to make sure that we meet monthly to talk about any quality issues that need to be addressed, training issues that need to be addressed, and, we're going to develop certain reports that we're going to look for on, a monthly basis. Councilor Leahy, you asked about, how do they determine whether they go to HMC or Bay State? They have protocols, and I'm not a clinical person, so, I look to my physicians to set those for us in their state protocols. But, you can ask these guys. I'm challenging them already. There was an accident down the street. Are those patients coming here? They going to Bay State? Because we want to make sure we give that local care in the community hospital and we get those patients. So,
I think one important point here is we're sharing that data with the hospital now too. So we're sharing how many, we're completely transparent. So Carl's getting numbers every month in terms of what the previous month looked like. So I want to say we had 467 transports in February that went to HMC. It was about 160 that went to Bay State. And there are questions about those patients, and we let the clinical people work through those particular questions and the whys behind it. So sharing that data and sharing the data with the entire team, because we report that back to the city as well, is critical from our standpoint, because if something needs to be fixed, we want to jump on it right away.
Carol, and this is regards to our hospitals around here, but I was reading the Wall Street Journal a long time ago. ACOs, that's coming. So it's almost like data boards where people are, I'm looking at this gentleman over here, the cost of care might be $1,000, but he might be $1,200, and so we're actually trying to keep the cost low, meaning borderline, I'm not going to run a test on him. I might run a test on him. If I'm the physician, this is correct me if I'm wrong, I'm thinking, well, maybe I'm not going to run a test on him because now my price per head just went up. That scares me. So if I walk in, I want the doctor to run as many tests as someone wearing the white jacket. And so is that the way we're going?
Yeah, we're not quite there. In the fee-for-service model where you know, the pendulum hasn't quite swung yet. It was, the doctors got paid on how many patients they saw, right? And how many referrals they did, and those type of things. So,
Council Lady, you're talking about risk pools, and certainly that is on the table right now, dealing with certain sections of the population and how you deal with their risk and their comorbid factors, and people that have been sick a long time. A lot of people have behavioral issues and serious medical issues, so it's hard to determine on the EMS side which is more important. So that's where the mobile integrated healthcare comes, where you're actually reaching out to that customer and finding out what the basis is for why they're calling 911. Is it behavioral health, or is it because they don't have control of diabetes, or is it both? Very complex. So typically in the old system, what you do immediately is call 911. It's an automatic click, goes to the hospital's got to evaluate it, very expensive, the most expensive place to do that, whereas this new model, you're going to try to share that risk out in the street and reduce the overall cost, but improve the quality. That's the gist behind MIH.
I got two last questions, and then I'll open it up to any comments or questions. You know, the Holyoke Medical Center seemed to be heavily involved in previous contracts. Is there any liability issues that the city is now, I mean, I know you're not an attorney, but maybe you are, I don't know. Or you could play one tonight.
Feel like I
if
am
you'd like
sometimes,
to.
yeah.
We'll call you Juris Doctorate tonight if you'd like to. But I mean, is there any liability issues that now that Holyoke Medical Center seem to have a bigger umbrella over it now that now may have
no, the umbrella for us is no different than it was under the contract with AMR.
And Mike, let me ask you, what's your background? Like, I mean, tell me you were a firefighter before, right?
At one point in time, I was.
Right.
Yep.
Okay.
Been a paramedic since 1989.
Yep.
Moved
Where were
my
you a
way-
firefighter from?
Originally in Winchester.
All right.
So I've seen both sides of it.
Oh, good.
Yep.
Right. Does the police department have any thoughts on this at all that they'd like to share?
Well, first of all, the chief asked me to pass on. He regrets he couldn't be here tonight for the birth of his granddaughter, so he's
Our
really excited.
congratulations.
He's out of town. And, no, but I think we'll rely on the data there. I know there was some issues, and they were very open and had a meeting with Captain Duguay. It's really her area, but I think they had a productive meeting the other day, so I think we're pretty good.
So Captain Duguay is the go-to person for the police department?
Between the chief and Captain Duguay, yes.
Right, yeah, okay.
Yep.
Okay. And you're the head honcho for the, not only the fire department, but this whole
That's correct.
operation?
Another
wanna
one
be
of my
clear.
hats. And you know what, and the open line of communication is great, and we've already seen it work, and it's beautiful that if there is a problem, you know, early on, there was a call I got, I won't, go into details, and I immediately contacted Action through a conference call, myself and a deputy chief, and they actually changed their standard operating procedures based off of that call so that we could get a better response the next time, and I could never do that before. In fact, I didn't even know how many calls our EMS provider had before. So it's really, I'm really impressed with how I'm able to have this open line of communication.
Well, to speak for the, once again, I'm speaking for myself, but I think I'm speaking for all the counselors too. It's really great for us to be able to sit down with you guys and have this discussion, because the open lines of communication to us are really important, because we really see what you guys are doing all the time, and we appreciate it. So this is really terrific.
One quick question, Chairman Hopewell, this new protocol that you kind of referred to a little bit, is there any sort of state, or new model, I think was what you, is there any sort of state approval or state sanction, or state doesn't care what we do?
Oh, they definitely care, and mobile integrated healthcare has been very successful out in the other parts of the country. And they're actually in Texas and in Minnesota and other parts. And I've been to several conferences in D.C. for the last 3 years in a row to talk about the national model of MIH. So more and more insurance providers are seeing the value in this, and it's very slow for that reimbursement to come in. And through Mr. McNeil and others, they've been working with our legislators, Senator Rosenberg, Senator Welch. They've been out to these areas to see MIH in action, and they're very encouraged on what it does. Now, DPH is actually addressing this, and there's going to be some regulations coming out in July to cover the let's say, the first inning of MIH. They're a very new concept in this part of the state, if the state in general. So this, as far as a collaboration between a city, a hospital, and an ambulance service is unprecedented so far in this state. So it's going to be exciting to see, and I've heard nothing but good things, and we'll see, again, from a national level, this has a lot of the same ingredients. No two MIH programs are the same. You have many, many different areas. It's making people, connecting people to the hubs and spokes, and making sure everybody's communicating, and that's one thing. Carl, with the IT portion, is that with what the technology that Action has is that everybody's going to know if Mike comes to see me at my house for an issue, not only will my PCP know that, but the ER doctor will know that. Everybody will be on the same page for that visit. So that's exciting.
Commissioner Garcia, do you have anything you might want to add?
No, thanks. I appreciate it. Thank you, Counselor. Just to say that as decision makers, one thing that we can make note and definitely highlight here with this new service compared to the previous contract that we had is access to data. And I think you've heard that over and over again here today, that having this access to data really allows the folks that are collaborating at the table to know and understand where the needs are and how to plan or proactively address concerns on the different health issues that are impacting our community. And not only is it helpful for them, it's helpful for the counselors as well to have access to that data to decide more or less or understand more or less what's happening in our community when it comes to health. And I know that Councilor Leahy, and I think you mentioned it too, had brought up the idea of, is it a good idea for the city to own and manage their own transporting service? That's and through discussions I've had with the chief and with other folks, it's hard. Without data, it's difficult to say one way or another whether or not it would be beneficial for our community to run our own ambulance service. But this model right here, we have access to data we've never had before. We can review that. We can look at how many calls have been responded to. This is stuff we can see 3-5 years from now and compare more or less and decide through a planning process of whether or not that's a direction you in fact want to go. Or maybe you'll see something else in which where you decide, thank goodness 5 years ago we didn't go in that direction. We don't know. So I think that this model right here gives us that. It puts us more in control. And not only that, it's a model that's being looked at statewide, so it's a pilot, which is unique for this area because Hampden County ranks last in all of Massachusetts when it comes to public health outcomes and health factors. This can be very well, and they say that Springfield and Holyoke skew that data a little. This can be a potential solution to that, in which where other surrounding municipalities, gateway cities, may want to start looking into implementing as well. So I like this. I remain optimistic. I do want to take a step back and see how it works out. But I'm pretty sure that it's going to be nothing but, it's going to produce nothing but positive outcomes for everyone.
Is there a formal title for this new model? That I keep, the term new model kind of keeps popping up. Is there?
The concept is called mobile integrated healthcare.
Yep.
Or, as Mike said, community paramedicine. And again, it's a collaboration. Paramedics are out there doing their own thing. They're working under a medical director at the hospital. They're working with social work. They're working with behavioral health. It's basically getting the right resources to the patient before he calls 911. For many different reasons. So if somebody hasn't taken their medications in a week because they don't have any money, or somebody needs a referral to a drug rehab, or they're having issues with their alcohol issues, it's getting them hooked into the right services before calling 911.
Possibly, let me just add one thing to that. Maybe it's easier to describe it as it's kind of preventative paramedic medicine. Where the hospital has identified 230 or so patients that are chronic users of the hospital. Most of them are dual diagnosed with a behavioral issue and some kind of chronic ailment like diabetes, COPD. And due to their behavioral issues, they don't take care of themselves, they don't eat right. But we're going to try and track these folks in the community, and some of them will be homeless. And for those folks, we're going to put on a GPS, two-way cellular communicative pendant. And the battery runs out in 72 hours. So every 48 hours, we're going to go out into the community, find these folks, do a what we call an ALS assessment. The paramedic will go through, do vitals, assess whether the patient is in decline for whatever reason, and then we'll figure out the best course on how to keep that person healthy. Some of the other targeted patients might be seniors that don't have much contact with the outside world that we'll go by and visit on a regular basis to make sure that they're maintaining their health. If we sense that there's something askew, that they're in some kind of decline, we'll preventatively take them to the hospital. So the example we use a lot is somebody that might have a cough. If they let it go, it becomes bronchitis, it might become pneumonia, and now, Carl has got them for 30 days, and maybe he's not being reimbursed for that 30 days. So the costs kind of become absorbed into this system through a preventative means, where if we're out there stopping those month-long stays, it makes it worthwhile for the cost that we expend.
And if I could just, before you go on the high-risk patients, I'll remind you of that term in a second. So one would have to assume that if the hospital is noting key patients that are constantly at the hospital, that impacts you because they're constantly calling 911. I'm just trying to connect the puzzle, the pieces here. So
You're right on
the hospital identifies 200 patients that are always in the hospital every 2 months.
Yeah.
Because they're drunk or they fell down or they forgot to take their medication, whatever the case may be. They're calling you. You're getting dispatched to say, "Hey, Barbara Jean, nice to see you again. We're bringing you back to the hospital because you forgot to take your EpiPen. You lost it."
Well, they're just not calling us. They're calling the police department. Police department's rolling, potentially the fire department's rolling,
But
and then
but the hospital identifying those folks is going to impact.
I have to sit here and say that this would not be an option if the hospital hasn't done everything that they've done with the grant money they've received over the last few years. Their data, the people they have working in the field right now is absolutely amazing. And being able to integrate with that team is going to be the key for success. And they've already set, the hospital through Carl's staff has already set this foundation up to make this a successful project in the end. They know how to take this to the next level and what most likely needs to be done to take this program to the next level. So working hand in hand with this and layering the system with their support staff and medical oversight is the key to ultimate success here and will ultimately benefit the hospital, the community as a whole.
And we've already identified some of these patients. We've transported one patient 13 times since the beginning of February already. So we can't wait to get into this data bank that Carl's collected. And the scary part is, once we work through this 230, his case management folks say there's another 3,000 behind that. When we went over to the health center, they told us they have 600 patients right away they would love to put into this program. So we're never going to fall short of folks to be out there monitoring, I can tell you that. But I think through our efforts, we'll find that these folks are going to the hospital less, that they're healthier. And we're also taking this to another level. We're using some databases to keep track of high-risk patients. And in one particular instance, we're calling her patient 1, is the first patient was a 13-month-old baby that has experienced some seizures in the past. And we went out and collected some data from that family. We've entered it into our database, and we're going to track the progress that this little child has. But anybody who's high risk, we're going to try to allow them to put a profile in our computer system so that when their number pops up in our computer, we'll already have a patient profile available to our paramedic as they respond. This will be available to people in the city who possibly have children with peanut allergies or any of those things. So if they're already listed in our database, as we respond, we've got a heads up on what we might encounter when we get to that address.
All right, I'd like to move that this.
Well, I have one last question. And it's funny you say peanuts because now the FDA is recommending that we expose children to peanuts before 6 months, years of
Today
age.
they are, yeah.
But anyways, is there any other communities in the state of Massachusetts, and it's just a quick question, that is participating? And I know this is kind of loose. I'm not saying this is a solid data or program, but the mobile integrated healthcare, is there anyone else in Massachusetts that's using, just for, so giggles, we could call up, if Chicopee was doing, hey, how's everything going over there, because they've been doing it for a year? Because this, apparently, if this company just came in February, this is all kind of, this is like hot off the books here.
If I can address that. Of
course.
So there are a couple of pilot projects that have taken place in Massachusetts. Those pilot projects have been driven by the insurance companies. They're under, as a pilot project, the Department of Public Health is overseeing it in the form of a study. So it is in process. But the difference between what's those projects are and what this project will be is this project will be driven by the community's public health and the hospital versus the insurer. So,
And what communities are there, would you know?
I'm sorry?
Would you know the communities?
Actually, there's the major insurer that's experimenting with this is Commonwealth Care Alliance. And so it's not necessarily a community-specific project, it's a health insurer-based
Got it.
specific product.
So everybody's happy at this table because we cut budgets, we cut things, so you're saying it as a, uniformly.
As a last comment, Counselor, again, this program has been up for 2 months.
Yep,
And
right.
I can tell you from firsthand observation, I'm impressed. We still have some bugs to work out, just
Sure, of course.
communication issues with the trunking system, and there's, a lot of people that are working together, and for the first time, between the hospital, between the police department, fire department, so there's relationship building going on. So again, for 60 days in, I'm very impressed. I'm not saying that there's issues that we don't have to work out yet, but as everyone here has said, the communication lines are open.
I'd like to move in that this order's been complied with.
All in favor? Aye. Got any cards? Love to have one. Gentlemen, thank you. Carl, we don't need you. Mike, we don't need you. We'd love you to stay. We'd love you to stay.
I'm Linda Griswold.
Great, thank you. Yeah, mate, you too. And anytime. Thanks, Frank, appreciate it. Yep. Thank you, sir. You guys saw the agenda, right?
The reason I'm asking is related to my regular.
I knew you were, I could tell you were the copper fighter.
Because I work at
Appreciate you coming in, man.
director has reached out to your company.
Mike, this is Mike.
Hey, how's it going?
I was just dishing Frank's out.
Thanks.
But she may be all set with it. But the last time I knew it wasn't partnership. So I just thought if I got I mean, I don't know you're okay. So I'm not sure where the call went. But I thought if I could give you this time or two that was still up in the air a little, you would be the folks to reach out to.
Absolutely. So I'm local. I'm the manager for the operation.
So maybe you would be the best in that regard, but it might not.
He's on his way over.
But I was thinking that, and it was commented upon a couple times, because everything's so cost-driven now. But this looks like it would be really better to go. Because people who keep sending themselves to the ER aren't usually doing the best thing they could for themselves. Thank you. You read my mind.
4 and 7
I'm Linda Bacon. I also work at Loomis House.
are
Our
together.
executive director, I know, reached out somewhere in your company once she learned that you were the city contract. And
Second.
All in favor?
All right.
gotten it done.
Chief, we're gonna just get a couple housekeeping things quickly out of the way,
In case.
and then we can talk to the kind of heavier or.
Nice to meet you. Thank you. Nice to meet you.
Item number 6 is that the city council approve the City of Holyoke 2016 Natural Hazards Mitigation Plan update. Oh, really? Okay. That's fine, yep.
Natural hazard mitigation.
Thanks, Chief.
If there's a storm, flood, hurricane, tornado, in the city, we have infrastructure within the city that would protect.
I'm here for item 3. but that's okay.
We're just gonna, I thought.
I know, you're just, yeah, I know, you're kind of,
I think we can shoot through it quickly. This has been approved before. What
Yep.
it is a plan. And this is how thick the plan is. I didn't want to print it out for everybody. It's through the Pioneer Valley Planning Commission.
Yep.
Church House. Some things. We have a committee that we put together, and in the front page of this, it has all the names. Basically, it's all the departments in the city. We got planning, board of health, fire department, police department. We go through, we look at critical infrastructure within the city. If there were a natural event occurring, how that would affect our operations in our city as a whole. For example, if the dam breaks, what happens? Do we have anything in place, any fail-safes to protect our community? There's things out there, we have floodgates that we put up.
We got a plan. There's a plan.
It's all right, it's a plan.
There's a plan, right?
So this was approved, I want to say 7 years ago, and it's been updated now. Through that committee. So with the updates now, any new infrastructure we have, we've determined how we would protect that. But the real beauty of this plan in itself is, once it's approved, we can put in for federal grant money to upgrade some equipment that needs to be updated, like floodgates, flood controls, things like that. I know the G&E got a grant a few years ago off the old plan to do some work. So that's, in a nutshell, that's really what this is. And the handout, just, I was gonna go through it quickly, but if you look through it, it's just basically further discusses in detail, you know, what it's about. This plan is actually, we updated it last year. We sat together for 6 months. We updated a plan. We had regular meetings. It went through FEMA. They looked at it. They said it's good. They approved it. It came back to the city, and now it just needs city council approval to accept the plan. There's no cost to the city. It's just us updating the plan and that you're aware of it and what we're trying to accomplish.
I'd like to move to accept the plan.
All in favor?
All right?
So it'll go before the full council, and
Tuesday.
you can,
Right. If I could see it.
if you could see it.
Read it.
We need one of those we
just
need
kidding.
one of those
I'm just
glasses.
kidding. I know.
I already know what it says because we're doing it where I work.
Right. No, it's kind of a simple one.
Thank you.
Take item 3 up.
Second,
All in favor?
All right.
Item number 3 is order that the Holyoke Fire Department surveillance video or other video available in call logs be provided to the Public Safety Committee for review for the Northeast Street fire.
So if I may.
Counselor Bacon, please, if you want to just.
So
kinda-
just to give a little context to my order.
Sure.
The reason that I wrote it the way that I did was because I was trying to sort through all the understanding of all the laws and regulations and the who was who, particularly between the central station and the alarm company and the owner. And I never really wanted to be an expert in this. I already know more about it than I ever sought to learn. But nonetheless, when these things happen, you start getting a lot of calls and a lot of questions. So in the effort of trying to be responsive, I was attempting to understand what the situation was on the day of the fire. So what I was aiming at trying to learn by filing this order was who the alarm company was for this property on the day of the fire. Once I understood that a central station was not the alarm company. So
Okay.
that's really the simple question behind my order, because I'm just trying to understand in terms of the chain of events and the chain of communication, given in particular what we now know about the delay in the call actually getting to the station, how all these pieces fit together so that we as a community, with whatever discretion or ability we have to create any ordinances, if we do, could prevent this gap that occurred. So that's a long way of getting to my point, but
Okay, I think I understand. How can we in the future ensure that these calls get to
Well-
us in a timely fashion?
well,
by
I really want
creating
to know
ordinances?
who the alarm company was, because I think the people and the public want to know that there was one, if there was, and that there wasn't if there wasn't.
Okay, there was an alarm company. There was a technical issue that did not allow the alarm to go to the alarm company from the occupancy, which in turn, when the smoke detectors went off in the building, it became a local alarm, so the smoke detectors only rang in the building. It didn't go to the location it was supposed to contact the fire department. In essence, that's that 10-minute delay before we actually even got the call. So if I can get in that a little more detail, there's processes in place. So alarm time, the call comes to the fire department, right? Our alarm room operator gets it. They have about 60 seconds to receive the call and dispatch the call.
And I'm
No.
not,
No, but
I'm
if I,
not concerned about that end of it.
right, I just want to give you a little clarification on something. So
Okay.
we're talking about the call, the alarms are going off, and this is why when I was on the news, I talked about you need to call 911. Because even if you think it's going to the fire department, it doesn't always get to the fire department. It's not always a connected system. So by the time the alarm operator rings out the call, the firefighters have turnout time. They have a minute to get down to the apparatus, put their turnout gear on, and get out the door. From that point, when we try to comply with NFPA 1710 standards, you have 4 minutes to get from your station to the call in your area. I can tell you that Engine 1 and Truck 1 got on scene in 3 minutes and 38 seconds. That includes turnout time. So think about that. The response was quick and efficient. So just want to touch that
Right,
point.
but that's not what I'm driving at. I'm
I-
not
I know,
questioning
but I
that.
just wanted to go in line with you're
Right,
talking
right.
about, to let you know that the system worked. The problem was the alarm. So yes, I'm with you if we can change some ordinances or get something up to ensure we get that call in a timely
Right,
fashion.
so what I'm trying to drill down to is the time, there's no argument that the system worked in the building. What I've heard informally throughout the community is that there have been so many false alarms in the building, many people ignored the alarm. And that's a different sort of problem. That's a fire prevention, public education problem. And we have, in comparison to many communities, a pretty robust prevention department. So that's one aspect of it. But the other aspect was that the system in the building worked. The communication problem was known the Friday before the holiday. It has been reported. And so the central station, and this is where, okay, my understanding is the central station was responsible for informing the building owner that there was a communication problem. What I've been told by more than one alarm company person is that if they can't fix it, because then it goes to them to fix it, that while it's not a law, as I've been told, it is a standard in the industry that if they're aware that it's not working and they haven't been able to fix it, for lack of a better word, I'm going to say the good ones would call the fire department and say, I have a building, it's got trouble, you're not going to get the alarm. If there's a fire call, you got to get a fire watch. Is my understanding accurate?
You're right on target.
Okay.
If we can
So-
actually put a fire watch there, if there's a public safety hazard and we feel that, we can enforce it to have a fire watch there.
But you have to know.
Have to know about it.
So, my general question, and we'll have to get legal in on this. So, I've been doing my homework. I've talked to the people up at the state. I've talked to everybody and their brother. I know we can't touch what the state has set up and that the owners can pick 1 through 4, their pick. But I think there's an area where if the state is silent on it, we could locally say, for example, and I'm throwing this out there because I don't know for sure, so I'll ask it as a question. Could we say in a local ordinance that for alarm operators, the repair people, that company that we're talking about, if they're aware they must follow the NFPA, whatever number it is, and report it to the fire department. That we could create a local ordinance to that effect because the state is silent on it. But it is a standard. Would that be something that you think would be a good thing for Holyoke to have? That it's a suggestion put to me by a non-involved person who works in this area.
I mean, I think it's a great suggestion, but obviously we should talk to legal and make sure that we're not doing anything crazy. Yeah, I mean, I would like to know.
But I mean, so tomorrow, there's a number of alarm companies that you know that if that circumstance had existed on a Friday, they would have called you. Is that accurate to say?
That's correct. Yes.
And I would like them all to do that in that circumstance. I mean, we're talking a high-risk building.
Right.
And there's nobody alive that, you don't have to be a fire expert to look at a building like that and say, man, if a fire goes up there, it's going to be bad. And I mean, we have a number of them because they're so tall and they're so historic in structure.
Yep.
So if it's legal, would that be something that you would find helpful? I mean, as long as we're not, traipsing on the state. I mean, otherwise we could put it to the state.
Well, I know since all the orders came out about the alarm systems and whatnot, actually, we're working with the city solicitor's office, fire prevention, and the building department to put something together to give to the city council to approve. And so we're already taking those steps, thanks to the city council, to
Right.
ensure that this doesn't happen in the future.
Right.
So that'll come out at some point, and we'll be able to hopefully get that approved.
So that angle and that thing that I'm talking about now would be something to reasonably consider?
Oh, definitely. I mean, that'll be one of the suggestions we can discuss and see if we can make that work.
And just to follow up on it, did the company say why they didn't let you know?
I have not been involved in the investigation part. It's the state fire marshal's office, so they're doing that. But since we're on this, the building itself, I can talk that the state fire marshal's office works out of the fire department. Trooper Mazza, Mike Mazza, is actually works out of our department. He's put together a PowerPoint that he would like the city council to come and see. And he can describe the fire, the details, what happened on that day. To city council, it would have to be in a closed session though, because some of the video has to stay with the state fire marshal's office. So he asked that I invite you to see the video and his presentation on the events that happened on that day.
Can we get that in writing, Chief?
Sure, I can email that out or send it.
That would be
Sure.
great.
Right, yeah.
The sooner the better.
Right.
He would like to show you.
Right, and just to, I mean, correct me if I'm wrong, I got a 20-unit building in the city of Holyoke, and I have an alarm system on that I pay Joe Blow Alarm Company to monitor. I don't have to get you involved at all, do I?
That's correct.
Right, so I mean, that's the missing link here, in my opinion, is that the alarm system goes down, and Joe Blow, that owns the alarm company, calls up Dan Breslin and says, hey, that 20-unit building that you got, the alarm's not working. Okay.
When excuse me, if it's like a weekend thing, they don't have to call us. If the service gets disconnected, then they have to contact us.
Who's they?
The alarm company that's monitoring that system. So if it's, ABC Alarm and they're monitoring that, I hope that's not a company, just made it up, but if they disconnect that service, or if you say, hey, I don't want you anymore, they have to notify us. But if it's a technical issue, we do not have to be
But
notified.
am I obligated to have an alarm system at all?
You are.
And how many units and up?
It's going to be a 4-family and up, and it depends on
I have to
the
have
time
a
the
monitored,
code
I have to have a monitored system
have to be monitored.
on a 4-unit building or up, or 5 units and
5 and up, yeah.
Right, right. And it doesn't have to be connected to the fire department. And during the week, if the alarm goes down, ABC Alarm Company notifies you.
No, if they disconnect the service because you don't want to pay them anymore or don't pay them, then they notify us.
Right,
But if
but
their system goes down because they have a problem, a technical issue, they do not have to
So in
notify
other
us.
words, you guys become the strong arm to get private companies paid if the service is discontinued. But if the alarm system doesn't work for whatever reason, not because they're not getting paid, you guys don't have to get notified. So
Correct.
basically, private alarm companies are using you guys to be the strong arm to collect their
Well-
bills.
Well,
And
in
I'm not, I
essence-
say
in
that, I
essence,
say that with
yes.
love in my heart towards
Yeah.
you, Chief, you know that.
In
but
essence, yeah.
I'm just, I mean, that's what it sounds like.
Yeah, they notify us, and then we go and
Then
find out why there's
You
no.
guys go do the dirty work and start knocking on the door and say, well, how come it's not working?
Yeah,
Okay.
you got it.
Well, that is one aspect of it, but the other thing is, you don't want them calling the fire department every time there's a phone problem
Right.
that they're out repairing. You'd have to have a full-time person just answering the phone every time there was a trouble with an alarm, because I mean, these guys are running back and forth all the time because it's a phone thing, a Wi-Fi thing, a this thing, a
But
that
they're only
thing.
contacting the fire department. The building owner is only contacting you if there is a discontinuation in the service.
It's not the building owner, it's the alarm
Oh,
company.
right, that's what I mean.
contact.
The alarm
Yes.
company's calling you if there's a discontinuation. If they're having a problem or it's just tripping off, I mean, you guys wouldn't know about it anyways because it's not connected to the fire department.
Right,
Right.
but if they're following the high performance codes, then the alarm companies should be calling the fire department if they can't fix the trouble.
Correct.
Are they?
But that's
No.
some are, some aren't.
So that's what we're talking about, is putting
This
language in there
one
to do this.
didn't, apparently, although it's under investigation, so you probably can't say, but it appears they did not.
They did not.
But there's no
They
legal-
did
there's
not,
no-
because the thing is, in that situation, so what I'm hoping is we can write an ordinance that says alarm companies operating in Holyoke must follow NFPA 22 or whatever the number is, and anytime there's a trouble that they cannot resolve, they will report it to the fire department, and that you, or whoever your designee is, can determine if a fire watch is required. And that you're gonna do it, or they're gonna do it, somebody's gonna do it.
Initially, that might take another person to control as well, because we may get more calls than we think, just like the EMS calls. We had no idea how many. So I'm
Well-
not sure how that's going to ramp up, but it would be good to get something in place so we have some type of oversight on the alarm system.
Right, but I mean, you do know which buildings are the largest multi-apartment complexes at the highest risk. So I mean, you got your low-hanging fruit to see which companies are in there and if you know them or not, right?
And you said earlier on, some of the companies are very responsible.
Yeah.
And some may not be in this.
And
is
you
an
know
option.
which is which.
This would be an
I'm gonna
option
guess.
to do it, to fix something. So, yeah, I mean, I think that's great, and like I said, we're putting something together, and
Yeah.
it'll be good to
All right.
get that out there.
All right.
Thank
So
you.
if that's in the mix, that would be great, because I think that would be, from what I have been able to discern, that was the biggest gap.
Counselor Sullivan?
Thank you.
Thank you.
So Chief, just so I'm clear, I own a building. I'm obligated to have the alarm system in the building by statute. I'm not obligated to have it go directly to the fire department if there's a problem. I'm obligated to have it go to whoever puts it in my building,
A monitored
a
system,
monitored system,
correct,
right? And over 5 units, it has to be a monitored system.
correct.
And so the only time the fire department gets involved on a monitored system in a building over 5 units is if that service is discontinued.
Right on.
Or the alarm company calls and tells them
Right.
it's not working.
Right.
Or we go there on a call and it's
then the alarm
disconnected.
company gets discontinued because they just tattletaled. I mean, who in their right mind would call the fire department and say, hey, you know what, the alarm system's not working? And then the guy that owns the building says, you know what, I'm gonna hire a different company because I want you to come to me first and not to the fire
But the
department.
good ones do call the fire
Right.
department.
Yeah.
Because the public safety is more important than,
Correct. I mean, we'll go to call sometimes and find that the system's down, and then we'll get this fixed now, or we're gonna have to hire a fire watch here to keep an eye on your building. It's been done.
So can you put an invite to the city council about the videos? Because the order talks about a video surveillance, call logs, none of which we've kind of touched upon, but Mike
Right.
Mazza is going to do a little show with some snacks.
Yes, and he would, and I'm thinking we do it at the fire department. We have the
Yep,
smart board.
I agree.
It's comfortable in there, and it would have to be, just the city council coming in and taking a look. So then you have an idea of exactly what happened on that day.
Now, was there video, there was video cameras in the building as well?
There's video in the building, and there's also video outside on the
You have,
police.
that's what you're
That's
talking
what-
about viewing, is the video that was in the building during the fire?
That's what Mike Mazza has.
Perfect, great.
It's a presentation to show you exactly what happened on that day.
Sure, and I'm just wondering, is there any reason why we can't know who the alarm company is or was?
Could be litigation.
I don't know who the alarm company is,
Oh, you don't?
no.
But you just know there was one.
There's an alarm company, I definitely know there's an alarm company and that there was a problem on that weekend.
So it's with the state.
State Fire Marshal's office.
Okay. Thank you.
There could possibly be litigation, so I don't think that's
Or
something
it's
I
probably
should be
because it's an
discussing.
ongoing investigation, perhaps.
Okay, so.
But thank you.
Motion to table?
Thank you.
All in favor? All right. Motion to take up item 4. That would be 5 and 7. Yeah, because the 4 is, Second? All in favor? Item 4 is an order from Councilor Sullivan that the Holyoke Fire Department provide all records regarding use of any time off, tardiness, or absences. This is to include all scheduled, unscheduled illnesses, vacation, or any other time off from December 31st, 2016 to January 1st, 2017, which is a whole day. Right?
Yep.
Okay.
Counselor?
Chief, Counselor?
Okay. The reason I filed this order is just the obvious reason. It's New Year's Day. There's been a lot of acrimony, it seems, back and forth regarding brownouts, staffing, and everything else, and I just wanted to make sure we didn't have a bunch of people not there because of a hangover or partying or some other reason. It's New Year's Day. That's simple.
Right.
The chief was great. I filed the order on the 17th. I heard from him on the 18th. There was only, all firefighters had planned time off at least a day in advance.
Correct.
So, that part of the, order is pretty clear. Were there any tardinesses, people didn't show up on time, or just plain flat-out absences?
No, everybody showed up that was supposed to, and the time was planned, so.
Yep. So, that answered my question. There was nothing else, to be considered, as far as that goes, and, question's been answered.
Thank you.
Counselor Graney?
Oh, that's good.
Take a motion.
Second?
All in favor? Correct.
Second?
All in favor?
All right,
All right, item 5 and item 7 basically are of the same gist. Item 5 was tabled from earlier. Item 7 was tabled from the last time we met, Chief. Do you guys have an agenda in front of you by any chance? Just so you don't want to, yeah, right, thank you. Thank you, Chief. Order that the fire department and the mayor come to the finance department to discuss department budget, staff, also any plans to discontinue the ironic brownout in the department. That was from Councilor Lopez. And my order was that the mayor adequately fund the fire department to keep all apparatus in service and in operation. This includes 5 engine companies and 2 ladder companies, 24 hours a day, 7 days a week, 365 days a year. Because they're in the same genre, we're just going to put them together. And we had met. I would have to. I would hope so. That.
The order says he wanted him to come in.
I agree. I don't know if he was notified. I have to assume that Ryan did. Chief, we had met earlier about this, and we had a good, healthy discussion.
Yes.
We don't have to get into that healthy discussion tonight. I'm just looking, our fiscal year is ending shortly in a few months. I know there's probably some leftover overtime budget. I also know that you have plenty of fans out there listening to roll call twice a day that are not on the Holyoke Fire Department that tell me when engine 2 is coming on, it's on service, it's off service. Retired folk that text me, that let me know that it's on or that it's not working. So I know it's sporadically online and then it's browned out. I guess the couple thoughts I had is that, and I know that that SAFE grant is down the road, so we get 10 firefighters. But I'm looking down the road, gentlemen. Now, if we're asking for 88 firefighters, fully staffed, and we continue to touch upon the NFPA stuff, when sometimes it's convenient for us and sometimes it's not, because you all know what the NFPA says for how many guys should be on a truck and how many ladders you'd need and all that sort of thing. I mean, if we're okay with, and I don't mean to say that we're okay, if we're settling for the fact that we're gonna have an engine out, then I'm gonna anticipate that the fire department's budget coming to us for the next fiscal year is not gonna be asking for 88 firefighters. Because it seems that, you asked for 88, 10 were cut, 6 resigned, we're down 16, 10 are coming through that SAFE grant, which I'm interested to know, is that, I know we've been getting it for years, but, grant money may not, you never know with new presidents, new administrations, what's gonna take place. So I guess the long question I have here is that if we're gonna survive with 72 or 78 firefighters, I'm gonna anticipate when this budget comes before the city council that I'm not gonna see that number 88 as a firefighter, because it seems that we have settled for the number 78, which is your decision, right? But as the chair of the public safety, I just want to be sure that that decision is what your decision is. So, the mayor's not the bad guy for cutting 10 out, or, the fire chief and the commissioners aren't the bad guys because we're browning on engines because there's no money. If we only need 78 firefighters, then damn it, let's have 78 firefighters.
Right. Fair question.
Can I just comment, if you don't mind?
Sure.
Here's my thing. It was X years ago where we bought 3, and I always say the wrong thing, engines or trucks.
Engines.
But we bought 3 in 1 year because we bought the compelling argument that it was must-do because it had been so many years since we had. But the irony is that now one of those 3 is the browned-out vehicle. So my thing is, we either need it or we don't. And if we don't need it, and if 80 or 90% of the time it is browned out, then we should either take another one offline and not have one sitting there browned out, so then we don't have a browned out vehicle. Do you know what I'm saying? Because if this is the new normal, maybe we shouldn't pretend that it's going to be something else. Because it's creating, and I'm not pretending to know the correct answer, but I'm just saying, if for 2 years, the reality is that we have one less engine being used, and that is the new normal, then I think it creates a lot of angst every time. It's on, it's off, it's on, it's off. People are feeling like they need something because we were told it was needed when we bought it. So you see the conflict there. So if there has been a new assessment and there is a new reality, because I know the other reality is also that many buildings have burned down. So they're not going to burn down again. So, the context has changed. Every year we've gone forward.
You're next.
It's changed yet again. But I would just suggest that if this is really the way it's going to be, then maybe we just should reconfigure the resources and not kind of have it out there. You know what I mean?
I know what you mean. Okay.
It's a tough question, Chief.
Well, it's not really a tough question. And to the point, I always ask for 88. I asked for 88 again this year because the big thing now is he said, oh, you're going to roll the dice, right? Anytime you reduce fire protection, you're going to roll the dice. But if we think on Councilor Bacon's terms and we try to, instead of spreading resources out amongst the city, we put them in locations that are going to best serve the citizens, that's a way around it. So if we really want to keep Engine 2 up and running, you really need 92 firefighters, not 88. Because then that would put 4 on every piece and 5 on the trucks, and that would be NFPA 1710 standards.
In a perfect world.
In a perfect world. Thank you, Counselor. No community in Western Mass complies with NFPA 1710
Don't have
standards
the
for staffing.
resources.
Nobody has the resources, not even Springfield, Chicopee, anybody. So to that end, the reason that Engine 2 is browned out, as I explained to the Ward 2 voters at their meeting, was there's 2 engines in one station. The population density is greater downtown, so to have 2 engines available to go out is better for us, but it's not necessary. So, the way you're explaining is if we reconsider our resources and think about where you want to put them, maybe we can have more people on engines and ladder trucks and not have that available at all, and we still respond to the same areas. When I talked about our response was efficient and accurate, and it's because an engine, a first due engine, has to get to its location within 4 minutes. And it does. It does according to ISO standards, the 1.5 mile circle that I showed. I know that day I tried to show you a little PowerPoint, but everybody just kind of fired up back here. When I showed the Ward 2 citizens, they understood it, and they were like, oh, I didn't even realize. I thought a station was getting shut down. No stations are getting shut down. Nobody's getting laid off. No, there's no crazy stuff going on. If we can reconfigure our resources, that's an option. And we're looking into that option right now, Counselor.
Thank you.
Can I add?
Commissioner.
Yeah, no, Councilor Vacan, you're spot on. And on Monday, we're having our Fire Commission's meeting to talk about that very point as to whether or not, do we continue to support the 88, or should we look into, reorganization of resources, right? So thinking strategically on that. So we've been back and forth with the mayor, with the chief, the chairman with the chief, having these conversations, and we hope to achieve a much more clarity and a strategic path forward. At least I hope so, as one of 3 commissioners on Monday.
And it's just not involving just staffing. We have fire alarm issues as well. We're down a lot of people. We have lights issues of being able to service our lights, which is handled by the fire alarm. We certainly looking at our EMD services. So really, it calls for a complete review of fire department operations. And working with the mayor and working with the police chief and the fire chief to see when you look toward consolidation, you look towards saving resources and giving the best bang for our buck with what we want to spend. And that's another issue that we've certainly been in front of the council mid-year coming back for overtime. That's always a difficult thing because people aren't going to work for free. And if you're going to staff those trucks, you got to pay people and you got to bring overtime in. So it's a catch-22 because we come back and we ask for, last year was a couple $100,000. You gave us $100, and this year we're under budget, and that is because we're managing our resources better. It's a catch-22.
Right. I think that, and Councilor Leahy's going to have a question. I think that, and I'm not looking, this is just rhetorical. I think that the money for overtime or the contractual buybacks, you guys should have came to us for, and you didn't, because we would have given them to you. Because the money was, that money was taken, correct me if I'm wrong, Chief, that money was taken from different line items instead of coming to us to give you the free cash.
When I did my, when I put my budget in last year and I got my final dollar amount, I'm pretty sure City Council said, don't come back. So why would I come back? And I'm still living within my budget.
But contractually.
I think you did the right
They've-
thing.
they've been-
If
it's been
Bobby
done.
retires and he's got 1,000 hours sick time, we're obligated to pay him.
I exhausted the funds I had within my budget, and now I came back, I don't know, last week or whatever, to get funding for contractual buybacks.
Right,
So I understand how it works. I'm trying to live within my budget.
Right, but I mean, didn't you transfer the money out of those firefighters' line items for those reasons? I mean, those 6 firefighters that weren't hired back, I mean, wasn't that money taken out of there?
There was no available list at that time, and there was not going to be an available list until the beginning or 2 months into this year.
Right.
So by the time we keep going forward, it's not going to matter.
But the money that was taken out of those 6 line items were paid for contractual buybacks.
some of the money, not all, not every line item was exhausted to use it. But yes, because that's living within your budget. That's what a manager does when they have a budget.
Counselor?
Yes, yeah, thank you. Before I say anything, the chief is absolutely on target. Comes in front of the finance committee. Every year, we say this to you, we say this to the police chief, DPW, Bill's gone out, but we say, all right, this is it. Stretch this out as long as you can. So what he's saying is, and Linda knows, he's on point. I'm not sitting here pretending I'm a fire expert at all. You are the fire expert the city has, and I thank you for being our chief, because I think you're a fantastic chief. And I'll certainly go on record as one of your biggest supporters. One of the questions that people have been asking me is exactly what you just said, that stations aren't closing. You have an engine that's closing, but I think the perception out there is an actual station is closing. And I think perception's reality, and I think that the fire department has to go on a better job of notifying the residents, or, I don't know if you have a Facebook page, I don't know, but letting the people know out there that they are being protected. They are. This guy who talks more than anyone. I think you guys have to certainly work on a better, community relations in that pursuit, because I don't know how many times I've heard that, I can't believe you're letting this station close. I can't believe you're letting that station close. And I'm like, first of all, it's not the city council. We gave everything, exactly what you wanted. We didn't cut your budget at all. So certainly don't put that on my shoulders. One of the things that I was wanting to ask you is, have you guys have you done an analysis about the shift? It seems like prior to this shift, I don't know how long ago it was, 8 years ago, 10 years ago? Maybe. Yeah. It seems like we had less issues with overtime. We still had a lot of overtime, but it didn't seem like it was as bad as it is now. So have you guys done an analysis if you guys went back to the other shift?
I have not, but the reason for that too is you have less staffing. We have a minimum amount of firefighters we have to have on duty to keep at least 3 on each piece of apparatus. So that's a problem right there when you have less staffing. In order to keep that staffing at a minimum, which is 19 now, you have to pay overtime to fill the shifts because you don't have people on duty.
But if
that
you
are
had
supposed to
people
be
there, they would be able to fill.
Right.
So I'm thinking you guys should relook at the shift change.
Well, we don't have people there because we don't have the staffing. That's where the 88 comes from. You're going to have 22 firefighters in each group, 4 groups. There's different ways to do it. When you don't have 88 and you have 72, then that cuts down the amount on each group, in essence, and then you're going to need to hire overtime to keep that up.
Council, we talking about 24-hour shifts?
Yes.
It's like
Yes.
you work 2 days and you have 5 days off, or however it works.
It's still the same amount of hours that they're working. It's really, it doesn't have any, shouldn't have any decision or any impact on it, because
No
it's
play.
still a number of hours that they're working. All they're doing is bunching the hours up into 2 days.
Yeah, no, I was just
as
wondering if
opposed
you
to
did
4.
analysis, just looking at what's happening now compared to what was happening prior, because in my recollection, it doesn't seem like it could be. I mean, it was a long time ago. I don't know how many years ago. Maybe it was the same, maybe it was more. I just don't think it was. That's the only questions I had. Thank you.
Oh,
The station closing, but we still have the same amount of structures in the city that you have to cover. So
Right.
if a station closes or if there's fewer firefighters on, we still have the same, and especially if we have more abandoned buildings, because with the abandoned buildings, I think that the fire, what do I say, the possibility of fire increases. The more abandoned buildings that you have, the more critical the situation is. So, that's why, we'd like to see if we could possibly afford it to have the entire department filled, so that we could provide that service to the community.
and that's, as I always say, I would love to have the whole department filled. I'd love to have Engine 2 up and running, but I also understand the fiscal constraints of the city and how that has to balance out. So as city council and the mayor, that's your decision. I put in my budget, I'll work within my budget. That's what I do. As far as abandoned buildings, we've taken a comprehensive approach along with the building department. We've fixed a lot of abandoned building problems in here. There's still a lot more, but we're on the right path. Through fire codes and building codes, we're fixing things, but we have to be out there doing that. So, yeah, I mean, I just have to take what I'm given, work with it, and manage it.
Go ahead, Counselor Sal. Yep, Counselor Vega.
Had something else, but
Commissioner Hopewell, you mentioned earlier that you were about to undertake a comprehensive review. Is this going to include the entire, I filed a order a couple of weeks ago regarding just actual same thing, reviewing the entire section of the city code that deals with the fire department. Is that what you're going to do?
As a fire commission, we've been looking at this. Certainly, we've had three retirements in our fire alarm division. We've had one person just leave recently for retirement. So we're very, very short. We're down to 4 people in our fire alarm room, and that's also to manage our lights. So it's coming to a crisis situation, and we're working with the chief and civil service to get a list and maybe get some temporary fire alarm operators. But in that same sense, and talking with the police chief and with our EMS folks, and looking at the system in general for EMD, which is emergency medical dispatch, when people call 911 for an ambulance, and also for a fire, is to consolidate those resources and use the people either over in the police department or in the fire department, but consolidating and trying to take some of the load off the fire department, but also looking at our resources from fire prevention, looking at our resources, and as we've talked about, for fire suppression. So as a commission, we're going to be looking at that from an overview perspective prior to the next budget being, I mean, Chief, again, Commissioner Garcia was at the first budget meeting with the mayor, so you can speak to that, but we're looking at trying to get the most mileage we can from our equipment, our people, and the resources we get from you folks.
Well, when I talk about a comprehensive review, I'm particularly talking about the city ordinances that deal with the fire department.
No, we're not looking at the ordinances.
Because you might, well, we've got the order in anyways, as we discussed now, the 88 to 92 people. The city ordinances call for 102, and according to firefighters, so we're talking about 82 and 92, the city, code calls for 102. We've got the overall population of the fire department, the city code calls for 138. We have 120. So, what's with the ordinances and where we're at with these numbers? I don't get it.
Councilor Sullivan, when I came onto the commission and I reviewed our bylaws or ordinances with the fire department, I've learned that there's a lot of misalignment going on, and a lot of it happened, I don't know, through history. And I think one of the things that I want to do as we get through our mini crisis here and we enter the fiscal year, one of my priorities is to bring this issue up and find out how the commission and the council and legal can work together and get that ordinance updated to where it needs to be, so that moving forward, we're abiding by our local ordinances.
And are some of the ordinances just so far out of the, the ordinance, I believe, says that to be a firefighter in Holyoke, you have to be a resident of Holyoke. And 37%, 44 members of our fire department live outside the city. So is it time to, throw some of these out that it just doesn't matter anymore?
So from what I'm hearing or what I'm told when I have these conversations with folks is that there's collective bargaining behind that. So there's some things, decisions and contracts or negotiations that were agreed to, I don't know when, that may be against what the ordinance says. So there's a bit of a conflict, and that's why I think as it's going to be very important as we enter the new fiscal year, at least now that I'm on this commission and we've reviewed that, and that we do look at that and, I don't know, modernize it to bring it to current. I can't go back for whatever happened before I came onto the commission or whatever happened 10 years ago, but certainly we do need to visit that and make the changes accordingly so that it's up to date and that we're compliant with our local ordinances. But I'm just as frustrated as you are.
Thank you.
Counselor Vacon?
Thank you, Mr. Chairman. I have a couple of comments and then a couple of ideas that maybe you could consider. Having been in the healthcare business where we've always had to watch costs, same thing. Revenues decreasing, responsibilities and regs increasing. One very helpful tool has been the recruitment of part-time staff, so that every time you're having to fill a gap, you're not having to use overtime. So I'm hoping when you're looking at revamping and restructuring, that would be one of the strategies that you might be able to consider. And relative to the comments on allocating resources, you know, we had a great discussion with the ambulance folks and how things are much more data-driven. And I'm thinking with all the data that you've been able to collect relative to the fires and the incidents and the locations, that when you're looking at the restructuring, you'd be able to put out to the community where the most incidents, frequency, intensity, da-da-da-da-da. So whatever reconfiguration you come up with, everybody, regardless of what ward they live in, is going to end up knowing that the resources are allocated based on data, facts that they can see, graphs that they can look at. And, you know, because you end up with people feeling shortchanged, and sometimes it's real and sometimes it isn't.
Right.
You know, but if it's out there, at least there's something people can see and understand.
It's actually out there. When I came in the night to present to city council, that was the PowerPoint, and I know it was quickly ran through.
Right.
But when I went to Ward 2 and discussed it with them, and you know, Councilor Leahy was right on with that too, that people didn't understand, and now I see why they didn't understand. The way the stations are set up now, they cover the areas where most of the fires are concentrated in. So there's overlap on fire stations, and there's all kinds of information that's been put together that we're ramping up to figure out how we're going to go forward with the fire department.
Right,
So-
and I know that you did bring it into us, and I do appreciate it, but I think it's just the general perception.
Yes.
You know?
Yes, oh, yes.
Yeah.
And I know Mike Plaisance put it out in,
Yeah,
so
oh,
everybody
yeah.
can look at it.
But-
They're probably looking at it going, well, I don't know what this means. I get it.
Well, right, and the other thing is when we live and breathe something,
Yeah.
to us, it's automatic.
Right.
It's like, and then you start thinking, well, everybody knows what you know.
Yeah, my wife tells me that all the
You know,
time.
I mean, it is the danger of living in something all the time, you know, but I mean, I think it's just, we want to make sure the people are safe where the people live in the buildings.
Correct.
I mean, I know the vacant buildings or something, but I mean, at least nobody's going to die if a vacant building burns.
Right.
I mean, not that we want to have that happen. You know, I'm not saying that. And my only comment relative to the ordinances is, I think those ordinances were written when we had 60,000 people.
Probably. And we had 3 ladder
And we
trucks.
have not gotten our government right-sized to the size of the city yet,
Probably.
in some regards.
I have a few thoughts, gentlemen. Has there been any discussions or plans to black out Engine 2?
Has there been discussion or plans? There's always been discussions or plans on that. If we're talking about reallocating resources and moving them appropriately, then that would be an option.
Do you know how much money you have left in your overtime budget? Ballpark?
129,000.
So we have April, May, June, July. What have you gone through so far this year, do you know?
I don't know. I don't know.
Well,
Was
do you-
that 350? So half of that, maybe, we just had the St. Patrick's Day weekend, so that's probably 20,000 in overtime in that weekend.
So we
Yeah,
had
50,000 so far after the first of the year. Plus, you can add the holiday or the St. Patrick's Day weekend. So 75,000.
Because I get all this, but I don't want the brownout. So I'm asking you, Chief, if you can get that. I mean, if you know how much you have in overtime, if you think you're going to burn through $120,000 in 3 months,
You never know.
I understand that, but, you know, from my understanding, you guys know better than I, but no lives probably would have been saved if that engine was there.
That's correct.
What probably would have happened is we wouldn't probably have run out of water in that building, with Cadigan up in that building fighting that fire, and he ran out of water, from my understanding. I haven't seen the video, and I look forward to that.
I was
But-
going to say, you'll see the video and the
Right.
explanation will be.
But, right, but I mean, it wouldn't, if engine 2 was not browned out, couldn't it have provided water?
Engine 3, Engine 5, Truck 2, they all responded to the same scene, and they were there in a very short period of time.
Right, but I mean, I guess when the mayor cut those 10 positions, and I don't wanna beat this to death, but when there was no outcry from anyone. I got no calls from the commissioner. I got no calls from the executive staff of the fire department saying, the mayor just cut 10 positions. So I have to assume that the commissioners and the chief are okay with cutting those 10 positions, which tells me that it seems kind of ridiculous that we're asking for 88 positions in this next upcoming budget when nobody called me and said, Dan, you know, we haven't had a brownout. When's the last time we've had a brownout? It's been years. And so, but nobody called me and said, Dan, as the chair of the Public Safety Committee, you have to be very concerned because we are down 10 guys. And now, and again, I say this with love in my heart. I'm not aggressively, y'all know me. But if we can get that engine back online for the rest of this fiscal year, that's what I'm asking as the chair of the Public Safety Committee. I'm asking you guys to get that engine back online for the rest of the fiscal year, because it seems foolish to me that there's no outcry for those 10 guys that were cut by Mayor Morse, and now you're asking for 88 again?
I ask for 88 every year.
But then don't, because it's foolish.
Every year I ask for 88, I come in here with my budget, and it's not 88.
Right, and
So
you know what the city,
why is there a
right,
public outcry?
the city council cut nothing out of your budget.
I agree.
I mean, I imagine there probably would have been multiple phone calls to the mayor's office saying, as there is on all, when department heads contacts about, hey, he's cutting this, he's cutting that, we can't do with it. It just seems that you guys may be of the opinion, and I'm okay with that. I'm not, you guys know this better than I, you're the department heads, that if the Holyoke Fire Department can run on 78 gentlemen and engine 2 not online, then ask for it and sell the engine. And that's not what I'm telling you to do. I'm asking you to get that engine up and running. But if you're asking for 88 every single year, because that's what we do in the fire department, we ask for 88 guys, and we know, because we don't need it, but we know the mayor's gonna cut a couple. I mean, I was a department head, I used to play that game, you ask for 500 grand, you get 480, but you only need 450 to run the department. So if you don't need the 88 firefighters, let's just stop, let's just be transparent and say, you know what? We don't need 78 firefighters. Stand by your decision, be okay with it, and I'll respect it. And then this matter will go away. We won't be discussing what happened, why that engine 2 was browned out. Could it have done this? Could it have done that? If it's not in existence, these conversations will not take place.
Point I was trying to make
But-
earlier.
I agree.
And
I think
to
you have an older engine than.
Commissioner Garcia, what you were saying before too, as we go through this ordinance thing, I still would not understand why any number besides what is in the ordinance is what the mayor would be able to, if the ordinance calls for 88 or 108 or 78, that's the number that should be coming forward. And to the other issue, as far as the other things go, the residents thing, that's half out of the bag anyways, but we want to hire the best people, the most qualified people. Maybe that, we've got to look at it. And maybe that ordinance has got to change too. But let's get something rewritten that reflects what we have to have for the city. And then we're not worried about no matter who the mayor is, what's coming out of there. We have an ordinance that says it will be this number of people.
Yeah.
Then all of this goes away.
I just want to add to that, me out of everyone in this room, right? I moved into my home in Ward 6 just 3 years ago. I lived 3 houses down from that building for about a good 5 years. My mother and my sisters, my wife's father, they're not together, they're roommates, are living in the housing development. There's just 3 houses down or so. And I have a lot of family and relatives that live in the flats. I grew up in South Holyoke. And this whole engine thing, engine 2 thing, I've been on the fence for a long time. I came off as very angry and frustrated and uneducated on the issue. Came onto the commission, did my research, did homework, look at the facts, continue to be engaged with the investigations, and I think once you've learned the investigation, I think it'll be clear to you, as it is very clear to me that, and I'm not going to speak for the other commissioners, but on Monday, I will be advocating for reorganization, a strategic reorganization in the fire department. I think you're right. Is it 88 or is it 82? Well, 10 will be through the SAFER grant, so maybe it's 72, and that'll bring us to the 82. One of the things we talked about is that if we move in that direction, we can get all fire engines and trucks fully staffed, not just at the bare minimum, right? Or we can go for the 88 and not have each of the engines and fire trucks fully staffed and just have the bare minimum and risk, going into the overtime pay and so forth. So I've definitely looked into every scenario possible. I stood behind the support of getting Engine 2 back on track. But again, as this investigation rolls out and the more I learn, the more I realize that, it's, and I'll publicly say it, I don't think it's necessary.
Let me throw out a hypothetical situation if I could. We're looking at,
Got to keep it lighthearted, boys. Got to keep it lighthearted.
we're looking at a situation that, we'd like to see that the engine in service till the end of the fiscal year.
Okay.
If there's 120 grand or whatever it is that's out there for overtime pay or something, we would, certainly as a public safety committee, I think we would be much more comfortable. For instance, Chief, if you're doing a balancing act as it is, if you came before this council and said, I need 120 grand to pay for overtime and severance because it's contractually obligated, if you spend that money to keep that engine in service, we'd be very open to allocating the extra money it was for, the overtime pay or whatever it is. And I know you're on balancing act. I know it's a tough situation, but we'd love to see that engine in service. That's all I'm saying,
Thank you.
You just got invited back to do what you were told not to come back and do.
If we can get the engine funded for the close of this fiscal year, why not? Let's do it. Let's move forward and get it going. If that's what everyone wants to do and we can get it, great. But it won't change whatever we decide on Monday on what direction we want to.
And we have to get another fire commissioner, because if you guys disagree on something. Oh, who is it?
Lumber.
Oh, okay, great, fantastic.
Now, remember, Counselor Sullivan, that was just a hypothetical situation.
Right, but again, as Josh pointed out, and I give you kudos, it takes courage. You only need 78, ask for 78, and we'll fight to make sure that you get 78 and then there's no brownouts, because that.
72.
Or whatever, right, you guys come up with a number. We'll back you with that number, and if the mayor decides to cut something from your budget, we're a simple phone call saying, we can't make it. If he does that, we're gonna have serious problems. There's gonna be tragedies. And I'm not saying this has anything to do with that particular tragedy, but again, you let us know, and, we go to the mayor's office and say, hey, Alex, you can't do that. It's not gonna work out. You help us on this, we'll help you on that.
So for the close of this fiscal year, so what happens after this, right? Do you go back to the full council body and recommend that funding gets allocated over and? We can't do that. Okay.
It's probably not going to go back to the council complied with, only because the order says to get all 5 engines up and running. And now if you're telling me you can't do that for the rest of the fiscal year, then it's gonna, how does the order go back? I'm not gonna table it. We don't want to, we've beaten this, we've had this. Right, the order's not been complied with, which isn't, it's not the end of, it's not a bad sign on
That's in
anybody.
the mayor's
It's just
hands,
saying, I'm saying,
Right.
I want that, I want all 5 engines up and running.
Above our
It can't
pay grade.
happen, order's not complied with, it's over.
You need twice that to keep that engine open from now until 3 times that. And the last part of this, the SAFER grant, we've
3
gotten.
months? 3 times that amount. For 3 months.
3 months?
Yeah.
And there's no other, there's no, and you touched upon the NFPA, there's no other communities that are NFPA satisfying the requirements of that, right? I'm sorry?
For staffing, no, not in Western Mass. I'm sure there may be somewhere in the world, but not in Western Mass. That's why we have a mutual aid system in place, so we can help each other.
That's good.
I mean, we spend time in other communities, they come over here, and it's reciprocal. So when we send somebody to South Hadley, we pay for that, and when they send somebody here, they pay for that.
That point should be noted too, because I was down there at the fire, I saw you guys. It was absolutely amazing, the fact that when Chicopee pulled up and South Hadley pulled up, it was so much pride for me, just knowing that these other cities are sitting there and they're moving.
Yeah.
It's not like they were just driving in slowly and jumping out of their, I mean, at one point, I wasn't sure who was who.
Yeah.
They all looked like Holyoke people to me. It was awesome. I was
And we do
extremely
the
proud.
same for
Thank you.
them, right?
It's a lot of coordination. It works well, very well.
We're gonna wrap this up, John.
Yeah, I just want to make one comment on the residency issue. Approximately 3 years ago, there was always a residency requirement. People cannot, I'm preaching to the choir, you know, nobody can be hired in Holyoke as a firefighter without living in Holyoke. So what is happening is, they live in Holyoke, they become a firefighter, and they move out of Holyoke. Prior to 3 years ago, there was an emergency exception that the chief could give to individual firefighters, which was taken great advantage of. Approximately 3 years ago, or 4, don't, quote me on that, Kevin Jourdain and I were instrumental in closing that loophole. There was some robust debate. There is mixed opinion about whether residency requirement is good or residency requirement is bad, and quite frankly, I could make both sides of that argument. However, what is compelling to me about our fire department is you must live here to get the job. So don't get it and pack your bags. That's,
If I could
so
add to that.
we tightened up that loophole in our ordinances.
Does
and
an
it-
ordinance trump a collective bargaining agreement?
Yes.
Yes.
But there's also been an ordinance filed to specify that. But you can't create a contract to violate a law.
But the contract was in place before the ordinance.
The ordinance requiring residency was in place, but it had the little loophole where an exception could be created. It was always there. It just had this little out, which we eliminated. But the residency requirement was already on the books when I came on the council, is to my knowledge.
But the collective bargaining agreement, that was already in place way back, that after a year's probation, you can move out of the city. That's been
Okay,
in there.
That part,
That's in there. I mean, that's been in there, and that's where we're getting all hung up on this stuff.
all right, but,
So,
yeah,
and,
All right, before these guys
yeah,
run out,
I live in the city.
I know. I know where you live. But I mean, that's just the recent history. So we'll have to iron that
I
one
just
out.
have to ask this question. Why only the fire department?
Well, because to my knowledge, the fire department is the only one where you have to live here to get extra consideration to get the job. The other departments don't have that.
Residency preference, that's civil service wide. Just a question.
No, but I mean, and that's the only answer I know. I hear you.
So is that it?
question, gentlemen, if you give me one.
Sir?
option of not complied with, or keep leave to withdraw?
I'm gonna say it's not complied with. That's what I would look for that motion from.
Second the motion.
Well, I can't make the motion. Somebody can make
Then
the
I
motion.
make the motion.
So the motion on the table is that these orders 5 and 7 have not been complied with. There's a second. All in favor?
Aye.
Aye. We're gonna send a copy of this to the mayor's office as well, letting him know that this order's not been complied with the Public Safety Committee. Chief, in closing, can you just get us, would we be interested in seeing that? If you could just get that from Mike Mazza, or the invite, a time frame, whenever you guys are available to do something like that, we'd appreciate it. That's great.
You said sooner the better?
The sooner the better. I can send out an email to Ryan and everybody tomorrow.
Fantastic.
And
That'd be great.
whatever times you're available.
Monday night would be great.
Monday night, well, we have a Board of Fire Commissioner meeting Monday night.
Tuesday, Wednesday, any day.
Okay. Trooper Mazza said April 5th will not work for him, but any other date, so the sooner the better, and
Yeah.
I'll just get it
Let's
out
do it
there.
after April 5th. I'll be down at the Masters.
Oh, okay.
Must be nice.
We're not competing.
Yeah, the school vacation's the 17th, right? Right,
And I'll
right.
be in Myrtle Beach.
Life of Riley over here with this one. So make a motion that to adjourn.
Yeah. Motion to adjourn?
It's not debatable.
All in favor?
Aye.
All right.
Thank you all.
Thanks, appreciate it.
And I'll try to set up a date, and then if not everybody can make it, then we can set up another date. He'll do it again.
Here you go.
Thank you. Good night.
Good. You don't want me to, them? No, just kind of saying hi.
See you guys.
Yeah, Mike.
Take care.
right, thank you, Mike, I appreciate it. I'll see you around town, I'm sure.